What is the novel coronavirus 19 COVID-19? The infective agent of pneumonia originated in Wuhan, China, is recognized as a completely unique coronavirus 2019 nCoV that causes COVID-19. The signs and symptoms embrace metabolism symptoms and fever, cough, and shortness of breath. In additional severe cases, the infection will cause respiratory disease, severe acute metabolism syndrome, and generally death. World Health Organization declared COVID-19 a deadly disease on 3 November 2020, informed to alarming levels of unfold and severity and confirmed that it's a primary pandemic caused by a coronavirus. 1. Dental professionals are powerfully counseled to stay to the rules and proposals communicated by the several dental associations of the region or follow the advice by the Dental Association (ADA) and Centers for Sickness Management and BAR USA (CDC). The use of normal precautions among the dental geographic point and indeed a radical history of symptoms and potential exposure for patients is vital for dental health care professionals to keep up a healthy operating surroundings, whether or not the priority is contagious disease, 2019 nCoV or different transmissible sicknesses, said Dr. Maria Geisinger, chair of the Enzyme Council on Scientific Affairs. 2. Infection controls for practice. Dental professionals ought to be acquainted with how 2019 nCoV is unfold, how to determine patients with 2019 nCoV infection and what extra protective measures ought to be adopted throughout daily follow to stop the transmission of 2019 nCoV. The infection management measures ought to be followed by dental professionals, chiefly as a result of aerosols and droplets are the most routes of transmission of 2019 nCoV. Standard precautions include hand hygiene. Emphasis on correct hand hygiene is very vital. Specifically, the oral care professionals ought to wash their hands with soap or make clean the hands with alcohol-based sanitizers. Before a patient examination, before dental procedures, after touching the patient, after touching the environment and instrumentation while not medical aid, and after touching the oral membrane, broken skin or wound, blood, body fluid, secretion, and waste material. More caution ought to be taken for dental professionals to avoid touching their own eyes, mouth, and nose. Use of private protecting equipment. Use of private protecting instrumentation, gloves, masks, eyewear. Considering that mobile drop transmission of infection is that the main route of unfold, significantly in dental clinics and hospitals, barrier protection instrumentation, as well as protecting eyewear, masks, gloves, caps, face shields, and protecting outwear, is powerfully counseled for all tending givers within the clinic-hospital settings. Based on the chance of the unfold of infection, 3-level protecting measures of the dental professionals are counseled for specific situations. A. Primary protection, standard protection for workers in clinical settings. A disposable operating cap, disposable surgical mask, working garments, white coat, protective spectacles or face defend, disposable latex or cyanide gloves. B. Secondary protection, advanced protection for dental professionals. Disposable doctor cap, disposable surgical mask, protective spectacles or face defend, working garments, white coat with disposable isolation consumer goods or surgical garments outside, disposable latex gloves. C. Tertiary protection, strengthened protection once contact patient with suspected or confirmed 2019 nCoV infection. Although a patient with 2019 nCoV infection isn't expected to be treated within the dental clinic, within the unlikely event that this will occur, and therefore the dental skilled cannot avoid shut contact, special protecting outwear is required. If protecting outwear isn't out there, operating garments, white coat with additional disposable protecting consumer goods outside ought to be worn. In addition, a disposable cap, protective goggles, face defend, disposable surgical mask, disposable latex gloves, and water-repellent shoe cowl ought to be worn. Disinfection of the clinic settings. Medical establishments ought to take effective and strict medical aid measures in each clinical settings and public areas. The clinic settings ought to be clean and disinfected following the protocol. 3. As the coronavirus will keep alive on surfaces for over 24 hours, it's crucial to stay all surfaces clean and alter. Whereas this pertains to the waiting area, the toilet, and therefore the front table, it's significantly important to make clean the operatory as oft as is possible. Common cleaners like 0.1% antimicrobic, 0.5% oxide, or 62 to 71% plant product have all been shown to be effective. 6. Public areas and appliances ought to even be oft clean and disinfected, as well as door handles, chairs, and desks. The elevator ought to be disinfected frequently. Individuals taking elevators ought to wear masks properly and avoid direct contact with buttons and different objects. The dental profession has various challenges and activity hazards, the COVID-19 being the new one on the block. Take care, focused, and follow the recommendations issued by the native health authorities or recommendations of the regional dental councils till we've got a far better insight and command of this sickness. These recommendations made public are clearly subject to vary because the clinical state of affairs evolves. However, they're beyond any doubt sensible cornerstones to assist dental professionals steer these anxious moments. As healthcare professionals and accountable voters of the planet, we tend to all have a job to play in fastness the unfold of the coronavirus and flattening the curve by following sound scientific public health recommendation, which can facilitate limit infections and curtail the unfold of the virus. The unfold of COVID-19 entirely depends on our collective actions. We firmly believe by taking these extraordinary precautions a dental practitioner will build a distinction in serving to sustain the restricted provide of private protection instrumentation (PPE) vital for emergency care and frontline health care personnel responding to the pandemic. Please keep yourselves and your patients safe.